Alright, welcome back. This is Health Matters with me, Dishen Kumar, and today's topic, we've been talking to Datuk Dr Selvam Rangasamy, the President of SAHAM. Thank you, Datuk, so much. We have had a very interesting conversation. Let's move on to something we discussed earlier actually, about treating the disease. Now, you have a very interesting opinion on this. So, Datuk, maybe you can share, how has that changed?
Treating the disease hasn't changed,
Okay.
Dinesh. We have changed.
Okay.
Because basically our teaching does not address the needs of a body. What the body needs is always something that is natural to the body. It is not asking for drugs. For any disease, it's not asking for drugs. Drugs are okay if you have acute emergency situations, but they do not heal. So, of course, I'll become unpopular by saying this. So, let's say, ask ourselves as doctors, what is my primary role as a doctor?
Okay.
I should be a healer. And to heal, I must be able to cure or reverse the disease. Can drugs do this? You cannot. There is no drug can cure a disease. And furthermore, the word disease itself is misunderstood. Disease does not tell you what is the root cause. It does not tell you the pathology. This is a collection of symptoms and we put a label to it. Say if you have high blood sugar, I call it diabetes. If you have high blood pressure, I call it hypertension. But the root cause is different. So in order to be a healer, that's my role, right?
Okay.
So the first principle of being a healer is, I only give the body what the body wants, and the body will only want natural ones. Even for hormones, you can't use synthetic hormones.
Okay.
We have been trained to use synthetic hormones. We are now training doctors to switch to natural hormones. They are very necessary, but you must use natural. So use only natural means. Number two, you cannot heal a person of their illness, any kind of illness, unless you address the root cause. And one root cause can also present in many other organs. For example, say we spoke about bone health.
Okay.
One of the most important hormone for bone health is testosterone, which is a male hormone. Even females have, but they have 10% of what we have.
Okay.
So if supposing someone has osteoporosis and they suffer a fracture, okay, they attend to orthopedics. This is necessary to fix the fracture. But if you do not pick up the root cause, the same testosterone deficiency in aging people will increase the risk of obesity, diabetes, heart disease, and for women even prolapse of the uterus and bladder, varicose veins. So one cause, multiple diseases. So how many types of treatment do you want to take? Whereas fixing the root cause will fix many of these things. So our primary role and our only role should be to understand the root cause and fix the root cause and do it naturally. And so the question comes, is it evidence-based? Well, there is so much of evidence. For example, which we'll be talking about vitamin C, there are more than 100,000 articles published in scientific literature. We have to ask ourselves, are we ready to look at it and accept? And why are we so reluctant to use something that is natural? So the same question I've been asking Ministry of Health. Why are we reluctant to try vitamin C for acute infections like dengue? It is totally reversible. So if it is natural, we shouldn't be hesitant. There is enough scientific literature. So evidence-based, in my opinion, should be an evidence to heal. So drugs are known to be evidence-based, but there are always side effects. So this evidence is not useful for me.
But aren't we being grown into the environment? I grew into an environment. If there's something wrong with you, you have to take something that is a drug or prescription or something to get better. But how do you feel that we need to change that mentality or that attitude that people have? Even going to a doctor, I would want him to give me something to make it better, make it go away, make whatever symptoms that I have to go away. So what do you think that we should do just to change that mentality a bit?
Now first we have to educate ourselves. This is what actually we formed SAHAM about, because we want to train doctors into understanding that a natural cure is possible. Almost all diseases. For example, diabetes is the easiest disease that we can reverse. So is hypertension, asthma. So if we equip ourselves with knowledge and we explain it to the patients, most patients will accept. There are times you have to use small amount of drugs to fix some acute symptoms. That's fine. Like in my clinic, I have not been using drugs for more than 20 years. I see variety of cases. I treat children, I treat women, I treat men, and I don't have to use drugs to heal. Even some of very severe conditions like autoimmune diseases, you don't need. So the onus is on us to educate ourselves and do justice to the patient. Now then you leave it to the patient to decide. If you are a good, if you create that awareness among patients, I'm sure most of them wouldn't want to touch drugs.
True.
Yeah, it's the awareness. So in Saham, some of the lectures are open to public because we want to create the awareness among the public. So we train the doctors and we create awareness among the public. So because doctors alone, exposing them to this kind of treatment, some of the doctors will still be reluctant and they wouldn't want to accept. Whereas if the patients create that awareness, they become aware of natural way of treating, then there will be a change.
All right, Dato'. Talking about creating awareness, I believe Saham has some event schedule coming up. What's the event about? Can you tell us that?
Okay, when it comes to health, everything about health is important. Everything that is natural that the body wants is important. Vitamins are important, minerals are important, hormones are important. But there are two most important molecules. So I call it this way. The two most important molecules that you produce and you don't produce decides how long you live. Okay? One of the master molecule that you produce is called glutathione. Of course, this is a medical term, but a lot of people know about this. This is the master molecule that every cell in our body must produce. If not, the cell will die and disease or death will occur. So, but this synthesis of glutathione is always there in all of us, but it is not enough because the diet we eat, the stress, the toxins and the pollutions depleting us. And this is the master for your immune system, master for detoxification and master antioxidant. So if you want to control about 100 types of medical disorders, you need this to optimized.
Understand.
So this is glutathione. So this is you produce, but we need to optimize because almost all of us are deficient, including children.
Okay.
One of the good reasons for cancer is deficiency in glutathione. The second most important molecule that we do not produce is vitamin C.
Okay.
So let me ask you a question. How often do you see animals getting cancer or dengue or chickenpox or Zika or H1N1 and on and on and on, tuberculosis? Yeah. We don't get. Because animals produce their own vitamin C. Humans are not able to produce vitamin C. Now the point is, if this was taught to us in medical school or we get ourselves aware of this knowledge, can't we do justice to people who are suffering cancer and infectious diseases? Yeah. So vitamin C, humans and some other mammals do not produce. Okay. So if you want to live a healthy, long life, you have to optimize with vitamin C. Okay. So these two topics are specially designed to be included in the June conference. We have two conferences in June and September. You can check it on our website. So it's on the 22nd of June, and we have invited a special speaker, one of the best in these topics from US, and this is open to the public as well. Okay. And if they are free, they can attend the second day, 23rd, to learn about the dangers of taking calcium and the benefits of taking magnesium. Okay. So these 2 days are open to the public. Okay. All right. Thank you so much for your time. And thank you for watching. This has been Health Matters with me, Dishen Kumar. If you have any questions or if you have any comments, please send them to us on all our social media platforms. Please watch all our videos. I will see you in the next episode. Thank you for watching. Goodbye.